Ontario is seeing COVID-19 numbers skyrocket again this week, closing the week off with over 4,000 cases being reported today. NDP leader Andrea Horwath says the province needs to move and get things happening. We got to ask the NDP leader a couple of questions. Here they are.
Hi, James.
Good morning, Andrea. We have a couple of situations here in Northern Ontario. First of all, on Monday, kids go back to school. The lockdown has been extended for all of Western and Northern Ontario, but somehow the kids are going to be going back to school. So a lot of parents are really concerned, as it sounds like they should be. What would you say to the parents, and why would we be opening part of the province and not all of the province?
Well, James, it's a really good point. And I mean, to parents, I would say that they have to make their decisions based on what they think is safe for their kids. But when we see the numbers of positive tests coming from testing of young children, I think it's really quite shocking that Mr. Ford and Mr. Lecce are prepared to risk the health of kids and the well-being of Northerners when it comes to potential spread of COVID-19. Look, it's nobody wants to have kids home from school for sure, but unless Mr. Lecce is prepared to, make those schools safe, reduce the class sizes, and of course, lots of kids take buses in Northern Ontario to get to school, reduce the number of kids in those buses to 50% of capacity, make sure every single school and every single classroom has the kind of ventilation that enables kids to be safe, and teachers, of course, and other education workers also, and make sure that there's some kind of monitoring through asymptomatic testing to ensure that those kids are not spreading COVID-19 amongst themselves and then back to their families. Then there shouldn't be that kind of risk being taken. But the problem is, Mr. Ford and Mr. Lecce just don't want to spend the money to provide those safety measures. They don't want to spend the money to keep our kids safe at school. And so, for Northern parents, I feel for you. I get the tough decisions that you have to make because your government has decided not to spend the money to keep your kids safe.
Now, in follow-up, I'm going to shift gears to you. There's been 22 deaths in the Thunder Bay District Health Unit region, which, for Southern Ontario probably sounds like almost nothing. 20 of those deaths are at the Southbridge Roseview home, and there's a report out this morning that literally says there's been a complete failure in that home. People allowed to wander around the halls, residents. It has just been a death trap for seniors. Why is that not being dealt with as fast with the iron ring that we were promised would go around long-term care homes?
Oh, James, I mean, it's heartbreaking to hear what's happening, but we know it's happening all across Ontario. And in my formal remarks, that's why I suggested that, and I've done this many times, so it's not a new request, but that long-term care minister needs to go. Ford needs to step up and should have been doing what needed to be done to protect seniors in long-term care through the summer, but they didn't do a darn thing. Ford sat on his duff and didn't hire more PSWs, and didn't increase the wages, and didn't make it a better job, and didn't provide sick pay for folks who needed to take time off work, and didn't provide isolation opportunities for people that might not be able to safely isolate at home if they get the virus, and didn't provide the kind of testing that needed to be done proactively all through the end of the summer, the beginning of the fall, through the winter, and now here we are, where lives are being lost, and those horrifying situations that you describe and that are happening throughout long-term care continue to occur. In fact, today we've hit the highest number of outbreaks in long-term care homes. And I'm going to say this straight up: this could have been avoided. We didn't have to end up in this completely chaotic and, as you call it, situations of death traps in our long-term care homes. But it was Ford and his folks and his minister that decided not to bother, and to suggest today that it's a matter of testing the workers and vaccinating the workers. That's his solution to long-term care is absolutely horrifying. shame on him. I don't know how he lives with himself, and how the minister can keep her job when we've seen the tragedies unfold that have unfolded. And again, it didn't have to end up here. Much of this could have been avoided, or at least the impact of COVID-19 could have been reduced in long-term care had the government taken the necessary measures to protect people's lives and to prevent the horrifying tragedies that have occurred, and the absolute devastation that so many families not only have been facing throughout these last number of months, but who are still facing this very moment.
Thank you. Keep up to date on the latest news and information for Western and Northern Ontario and beyond across Canada. Subscribe to our YouTube channel. Subscribe to our Twitter. And join us on Facebook, and always check out netnewsledger.com for the latest news and information.